Hello, Dr. Peter Balogh with some tips on how to treat sensitive teeth. First of all, why do our teeth become sensitive? And I'm referring to teeth that are sensitive to specifically temperature. It's usually cold. Cold sensitivity can be normal. We can have teeth that are sensitive for a little while, it goes away, but it comes back. But when it becomes quite severe, excruciating, and it's ongoing, it can be a real nuisance. A little explanation of what typically causes it. Our teeth roots are typically covered or buried by the gum tissue and the bone in the mouth. However, for various reasons, sometimes the gums have receded, the bone has receded, and the roots of the teeth become exposed. Root surfaces don't have any enamel on them. It's a different material. It's a bit thinner, a bit softer, and it tends to be more porous if you look at it under a microscope. So when the gums have receded, those root surfaces can be sensitive to cold air, sometimes touch with your finger, a tine of a fork, or even an instrument if a person is getting their teeth cleaned or some dental work done. When the root has been exposed and those porosities are open, the tooth can be very sensitive. If the porosities are plugged up, the sensitivity goes away, which explains why some people can have only just a tiny little bit of root exposed and it's excruciating. Someone else can have 3-4 millimeters or more of root exposed and it's not a problem at all, and it's been like that for years. Different things can certainly aggravate it. Acidic things, acidic foods, fruits, vegetables, so on, brushing it very abrasively, even allowing plaque to collect on there. The bacteria in the plaque produce acids that will tend to open up the porosities, and all of a sudden the teeth start becoming more sensitive. Clenching, grinding our teeth also can make the teeth more sensitive. Plugging up the porosities will help to alleviate it. So how can you do that? There's not a lot out there. Of course, every toothpaste company says they can do different things for helping this tooth sensitivity. Almost every product has got fluoride in it, which can help to harden the surface and can work a little bit to improve that. But in my experience, what works well is Sensodyne Toothpaste. Now, I have no financial interest in this company or the products or whatever. I'm just telling you this is what I tell my patients, and this is what I would use myself. The only reason I mention that is it's one of the few products that I know that has a couple of ingredients that actually has some true efficacy. It actually works. One of the active ingredients is something called strontium chloride, which helps apparently to plug up the porosities. Another brand of it has something called potassium nitrate, which works to somehow reduce the sensitivity from a conductivity point of view. But I find that they do work. Now, the big thing to make them work is to get it to stay on the tooth long enough. Of course, the companies like you to brush with it, use it up, and you go through as much toothpaste as you can. The problem with using it as a toothpaste, it's fine, but we don't brush long enough. We brush for 35, 40 seconds, minute, maybe a minute and a half, and then we spit out or rinse out the excess, and it's gone. It hasn't been on the tooth long enough to work. So you can certainly use it as a toothpaste, but if you've got some teeth that are sensitive, take a little bit on your finger. After you've brushed your teeth and flossed and done whatever you're going to do at the end of the night, before you go to bed, take a little bit and just rub it on the area that's sensitive, inside, outside, and then leave it there. Leave it there for about a good, as long as it will stay there. It'll eventually wash away. Your saliva will wash it away. The amount you're using is not an excessive amount that it's not going to be a problem or an issue for you, but you will find it will work much better. If you use it as a toothpaste, you could be waiting a long time for that sensitivity to decrease. But when I tell people to use it as a topical, they say they notice some differences in about as little as 2-3 weeks. So hopefully that will help. If you have any other questions, you can always check us out online at www.vccid.com. Send us an email if you have any questions. I'll do my best to answer it. Thank you.